All right, let's just dive right into this explainer. If you're managing veterinary, dental, GP, cosmetic, or podiatry clinic, I don't need to tell you that online reviews make or break your growth. But here's the thing. Navigating that feedback without tripping over privacy laws and doing it efficiently, that is a totally different ballgame. So today, we're going to break down exactly how to manage your clinic's reputation safely without the stress.
Because it's a really heavy question, isn't it? Choosing a clinic is a deeply personal choice for a prospective patient. So when you get a negative review, it feels like a literal emergency. Your instinct is probably just to jump right in, defend your team, and set the record straight, right? But in healthcare, rushing that reply can actually expose you to some massive privacy risks.
So here's what we're covering today. The one-star emergency, the healthcare privacy trap, why volume beats deletion, the private feedback path, replying safely and humanly, and finally, the 5-minute daily habit. We're going to shift you away from playing defense and move toward a proactive, volume-driven strategy. Okay, Section 1, the one-star emergency, looking at the high stakes of online reviews in healthcare.
The absolute most crucial thing to remember here. Your reply actually isn't for the angry reviewer at all. They've vented, they've moved on. Your reply is a live public sample of your clinic's temperament for the next 200 prospective patients scrolling through your profile. If you've only got a handful of reviews, that one negative comment is deafening. It completely dominates your digital front door.
Moving right along to Section 2, the healthcare privacy trap, and why a friendly reply can actually be a dangerous breach.
This is super counterintuitive, but medical privacy laws like APRA constantly catch out really well-meaning practices. Why? Because breaches often come from a warm instant. In healthcare, just confirming someone attended your clinic is classified as health information. That means all that generic retail advice you read online, it is completely unusable for you. The second you say, "Thanks for trusting us with your care," or "So glad Dr. Patel could help with those vaccines," you have publicly confirmed a named person was a patient. You have to reply to the words, not the visit. Keep it completely focused on your manner and your process.
This perfectly illustrates the difference. Look at the bot reply on the left versus the human reply on the right. See how that safe reply is warm and specific, but it confirms absolutely zero clinical details? It would honestly make sense even if that reviewer had never actually stepped foot in your practice. You are generously mirroring their sentiment without exposing a single drop of patient data.
Okay, Section 3, Why Volume Beats Deletion, where we tackle the myth of review removal services. Let's debunk this one right now. Paying a service to delete bad reviews sounds like a magic bullet, but chasing takedowns is incredibly slow and it honestly rarely works. Google protects opinions. They'll remove spam or hate speech, sure, but not a genuine client who just had a frustrating Tuesday at your cosmetic or dental clinic. Spending your energy trying to subtract that one bad review is just a huge distraction from your real job, which is collecting genuine positive reviews. Because think about it, 99% of your perfectly satisfied patients are never going to post a review unless you ask them properly. If you do nothing, you're letting the angry 1% completely define your profile. The goal here isn't deletion, it's volume. A busy, frequently updated profile with hundreds of reviews just naturally waters down that one negative comment until it's literally just statistical noise that future patients scroll right past. Which brings us to Section 4, the private feedback path. Preempting those negative reviews before they ever go public. Here is the structural fix. It's a dual-path system. You ask every single patient for a review. No filtering, no gating, which is absolutely crucial for compliance and platform rules, by the way. But alongside that, you offer an easy, direct, private route straight to the practice manager. This isn't about hiding the truth. It's about universal service recovery. You're just giving an unhappy client a real offline path to reach you first so you can genuinely solve their problem. And the results are wild. By offering that private route right alongside the public review ask, clinics see a massive 94% average reduction in negative public reviews. You catch the issues early, the frustrated client gets to actually speak to your front desk, their problem gets fixed, and they feel heard, instead of just venting their frustration out onto the internet. Now, automating this is exactly what the X18 review engine does. Generic software totally fails clinics because it just blasts out robotic, one-size-fits-all requests 7 days later from some third-party brand. But X18 is built specifically for healthcare. It times the request perfectly based on the cohort. So next day for a routine dental clean, maybe 2 weeks for an orthodontic adjustment, and it sends it directly from your practice, always including that critical private feedback channel. All right, Section 5. Replying safely and humanly. how to write in your own voice without sounding like a chatbot. For the reviews that do end up going public, both the good and the bad, you need this 4-part template. 1. Open with empathy, not defense. 2. Never argue the facts in public. 3. Offer a private follow-up channel with a real phone number. And 4. Sign off with a real name. When you do this, you immediately diffuse the next reader's doubt. You turn a public complaint into an invitation for a private chat, showing hundreds of onlookers that your clinic is reasonable and accountable. You've got to remember, generic AI replies just look so robotic. If you're copying and pasting ChatGPT drafts, prospective clients are going to pattern match that instantly, and it creates a massive trust leak. Taking just 30 extra seconds to use your actual human voice, like saying, "Waiting when unwell is genuinely frustrating," instead of a canned, "Sorry for the wait," it completely changes the entire meaning of a 1-star review. Finally, Section 6, the 5-minute daily habit, building an algorithmic freshness queue. We need to execute all of this without giving your front desk hours of extra busy work. The trick here is consistency. Assign one specific person, like your practice manager, to own this. Batch the work for just 5 minutes at the exact same time every single morning to clear whatever came in overnight. And hey, make sure you reply to the routine 5-star reviews too. This quick 5-minute habit signals to Google and your future patients that your clinic is active and attentive. Just do not forget to run that quick privacy check in your head before you hit send. Oh, and a super quick compliance note, especially for our viewers in Australia navigating HPRA guidelines. Collect your reviews and absolutely let them do the heavy lifting for your Google visibility. But under Section 133, you cannot use testimonials in your advertising, so keep them entirely off your website and your flyers. Just let them live natively on Google, which is where they drive the most value anyway. So as we wrap up this explainer, I want you to ask yourself, are you currently defending your reputation one review at a time, or are you out publishing it with volume? Stop trying to subtract one bad review by arguing with internet moderation queues. Start adding 50 good ones through a smart automated system like the X18 engine we talked about that gives every client a private path to reach your first. When you handle feedback humanely and safely, you build a digital reputation that genuinely brings new patients right through your doors. Thanks so much for joining me today, and I'll catch you on the next explainer.